Hello everyone, I'm Doug McCarthy. And my wife Susan and I are both local residents of La Plata County. We have a 12-year-old son who has diagnosed behavioral and emotional needs. We fostered him from birth, and we were thrilled to adopt him a year later into our family. Our journey in seeking services for his needs has been a difficult one. And I'm sharing that with you today and really appreciate the opportunity. Currently, from my perspective as a parent and a family, it appears that the system tries to triage the use of expensive services by waiting until there's a crisis. And I think everyone would agree that's counterproductive. It would be so much more effective if there were resources for the system to be preventive and to catch those problems, what they say, upstream before they manifest in a crisis. Our son's a perfect example of a child who really would have benefited from that kind of an approach. He was known to the system since birth as having neurodevelopmental trauma in utero, and yet there was no plan, no coordinated effort to connect him with services, to create a care plan, and to provide guidance to us on a trajectory and a path. And by saying this, I'm not suggesting anyone failed in their job. Throughout our experience, we have been served by people of good faith who really wished for the best for our son and for us, but yet that sincerity doesn't result in a system of care that serves us well. I'm just going to use an analogy since this is Durango. We have a lot of river rafting companies here. And when you book a rafting trip, you get a helmet, a life preserver, a paddle, and you're told how to work with that river guide to navigate the rapids and to get downstream successfully. Well, in that analogy, I would say we were given none of those things. We were kind of just shown to the river, given a hope and a prayer, and cast upon our wits and our ability to yell for help to anyone on the shore to see our need. As our son began experiencing behavioral challenges in elementary school, we sought out experts and they tried to be helpful. But in hindsight, we see that they were hampered because they didn't have a big picture of what was going on with our family. Some providers to whom we were referred would have been wonderful if we could have accessed them, but they weren't available. They were busy. And others were very focused on, let's say, medication management. And there was no holistic approach to helping us or my son. I don't think we rose up to the level of a crisis in the system and the risk assessment, and so we just kind of floated along. But through my wife's persistence, we were fortunate to see Dr. Heidi McMillan at Pediatric Partners here in Durango, and she was able to understand our situation, make a referral to a private practice psychiatrist who diagnosed our son, prescribed a whole suite of treatment, and connected us with the school district to establish an individualized education plan, or IEP. And with the support of caring teachers, he was successfully completed elementary school. So we thought, wow, we're on an upward trajectory. But then we hit middle school. Unfortunately, that's really a difficult environment for someone with behavioral challenges. His applied behavioral analysis therapist abruptly moved, and that sent my son into a tailspin. He refused to go to school. He became increasingly violent in tone and engaged in life-threatening behaviors. When we called the local crisis intervention line, we were told they did not have any help for children. So we were directed instead to call 911 to bring the sheriff to our home and transport him to the hospital, and that happened 2 times, which is very distressing. We realized that this trajectory was trying to prove need. In fact, we were kind of being coached to prove that need through these visits, and that was traumatizing in and of itself. So I'm going to make kind of a distasteful analogy, but we felt like laboratory rats wandering through a maze, enduring electric shocks to get to that food pellet that might help us. We were being conditioned to conform to a broken system that offered us uncertain help and benefit. By chance, I learned about the new collaborative management program, and I met with the local individual services and support team, or ISST. And I really appreciated that, but it really was too little too late. I would have loved to have met with them years before if that program had existed. What really disturbed us is that we learned that in order to really get the residential help that we thought our son needed and we needed, we might have to surrender our parental rights to do so. We decided to break this cycle. We didn't want any further trauma for our son or ourselves. We decided to invest in an outdoor therapy program recommended by expert to stabilize his functioning, and he's currently in a therapeutic boarding school where he's been making steady progress academically and behaviorally. We're excited about that, but in order to do that, we're spending down our retirement savings, and that will eventually be exhausted. Once those funds are gone, we will have no further resources to rely on should he require longer-term intensive services. So in summary, I would just ask the task force to consider families like ours, and I would urge you to create a more responsive system that will harness the goodwill of professionals, the cooperation of schools, and the lived experiences of families like ours, so that there is a more proactive assessment, care planning, and coordinated services and supports that will promote better outcomes for families like ours. That's going to require 4 things, in my opinion: convincing vision, committed resources, sustained effort, and authentic collaboration among stakeholders. I really feel that the well-being of children like ours and our society depend on that. Thank you.